Okay, so we're here with Anne Winslow. She is one of the key people in EMSP hierarchy in our leadership. She's been also working with the Under Pressure project for, well, it's now the 4th year of the project, and so she has a very good overview of how this project has worked until now. What effect would you say that Under Pressure has had on MS communities throughout Europe?
Interestingly enough, people with MS themselves actually feel an identity with the people who have shared their stories, and that in many ways, that sharing of stories has helped people to feel less isolated and also maybe better understood. I think also national MS societies and their staff, scientists, neurologists in the medical field have said it reminds them what we're all about. Seeing and hearing the stories of people with MS reminds them why we're doing the work we're doing. Also, I think, interestingly enough, when we look outside of the MS world, I think the images evocatively really describe what it's like if there's poor government policy or if there's no health policy in relation to access to treatments, being able to seek employment and stay in employment, get out and about and participate in daily life. It illustrates very well. So therefore, the role of EMSP in calling for improvements in policy that impact directly on access to treatments or enable people to live daily in their life, that is a good, I suppose, strong message that goes nicely with evidence-based research around inequities in treatments and programs and access.
Great. And now the second and last question, since this year is a very important year in the history of EMSP, what would be your message to EMSP's constituency? So people with MS, our partners or our sponsors, you have a broad message for them as we plan for forward the projects and to plan for the road ahead.
I guess my primary message is that people with MS need to be listened to. And we need to continue that, whether we're a scientist, whether we're a staff member, a volunteer, a national MS society. From that grows the work of the national societies, and in turn grows the work of EMSP, which is clearly we have a role in advocacy. How do we give voice to people with MS? And if we've listened, we can give voice. Secondly, we need to look at how we gather evidence-based research in the area of treatments and services, but also in how countries compare and how we need to improve the situation to ensure equity of access to whatever the person with MS is saying that they want, wherever they live. And I think that message is very key for me, that our aim ultimately is to ensure people can have a quality of life, the person with MS and their loved ones, wherever they live in Europe.
Great. Many thanks.